Hi, I'm Dr. Spence Jahner from Joint Repair Clinic in Montana. All right, so today we're going to talk about the big question, does this hurt? I'm here to tell you that I'm somebody who doesn't like needles. So one of the things that really concerned me was how painful is this going to be? And one of the things I'm glad to report is our medical team is awesome when it comes to these injections. I've had my blood drawn for getting my vitamin D levels tested, and I'm here to tell you that my injections into my knees was no more painful than getting my blood drawn for the vitamin D levels tested. So for the most part, these are very gentle, if I could say, injections. Now, I have to tell you though, when we inject hands and feet, because those joints don't have the cushioning material that our other joints have, hands and feet injections are often more painful. So I just want to make sure I'm being honest with you all to understand that we inject hands and feet and knees and shoulders and backs and hips. The hands and feet are often more uncomfortable for the injections, but for the most part, the rest of the joints, people are very pleased with how little the injections themselves hurt. I often ask our patients after the medical team does the injection, how painful was that, or how would you rate it on a scale of 1 to 10? A 10 being that it was awesome, a 0 being it was horrific, and the lowest number I've ever heard was an 8. There it is. If you're worried about how much it hurts, I want you to understand, yes, the needle does go in, but for the most part, these guys are awesome. And that's also important for you to know that I'm not the one that does the injections. We have a medical team that does our injections for us. So the good news is we do all of the procedures right here at our clinics at the 4 locations, right in the office where you do the evaluation, right where you get to talk to me if you come to Bozeman, or our other clinics is where we do the injections. Now, people sometimes want to know, well, if I have a shoulder problem and a hip problem, how many joints can I do at once? Or do I just do one at a time? And based upon the circumstances, we'll tell you what the best recommendation it is. Most joints we do at one time right now is 4 joints at one time. So we've had some patients where we've done both knees and both shoulders, or maybe a knee, a shoulder, a back, but we have different variations, but we can do up to 4 at one time. And there's advantages of doing it at the same time, and I can explain that to you when we do your consultation. When our patients ask us, how long will this take for me to get results or to recover? That varies from patient to patient, and it also varies from how well our patients do on their post-treatment care. And so some people notice benefits in the first month, some people the second month. We've had some patients that notice a difference in that 3 to 6 month time, which is typically where people notice the results. But we had one person that said, they noticed some results at 3 to 6 months, but it wasn't until almost a year with their hip that they really felt that they noticed the total benefit. So it varies from patient to patient, but one important thing that all of our patients need to understand is how well you follow instructions after your treatment. For instance, we have an anti-inflammatory eating program that is challenging because anti-inflammatory eating involves not eating sugar, and it's very disheartening because so many people's diet contains products that are high in sugar. And so if we want to get the best results with our recushioning the joints and are getting the range of motion and getting rid of pain, we need to get rid of inflammation. So we'll coach you through things you can eat, things you can't eat, so you can get the best results. But as far as how long does it take to recover or how long are results, a lot of that is going to be determined by what you do. But typically the 3 to 6 month range is a good rule of thumb. Some people before that, some people after that, but we just want to do this thing right. So when people ask me, does that mean no sugar whatsoever, or like how strict do I have to be on this diet? And my answer to that question is, well, how good of results you want? So if you want 100% results, then you got to do it 100%, and we're talking 3 months. Now, of course, I'd love you to do this eating plan for the rest of your life, because here's some side benefits of the anti-inflammatory eating plan. One of the side benefits that we hear all the time is people lose weight. Sugar is definitely the source of fat and gaining weight. Another benefit of reducing sugar is cancer cells thrive on sugar, and cancer needs sugar. And so by reducing sugar, I believe you're reducing your chances of battling cancer in the future in your life. You're losing weight, you're getting rid of inflammation. So I say go for it 100%, but I also understand, hey, we all like some sweets here and there in our lives. If you can reduce it, the more you reduce it, the better results you get now and in the future of your life. So you get to determine how well you want to get results. But the nice thing that I can promise you is that when you're frustrated about not getting to eat all the chocolate cake and the soda pops, I'll be frustrated with you because I like those things as well. If you need more questions or you want to come in and have a consultation with us, you can call us at 406-522-9959. You can go to our website, jointrepairclinicmt@gmail.com. We're here to help you out. Just set up a time and let us know how we can best serve you.